Hi folks, Dr. Palermo here again. I have an office in Strongsville, Ohio. And this time I'd like to talk to you about something else we do in the practice. It's an energy work. It's called BEST, B-E-S-T, and that stands for Bioenergetic Synchronization Technique. Now, we're all familiar with the energy field surrounding the body. Well, when that energy field gets disrupted, that's what leads to problems. Whether they're physical problems, outward muscle, headaches, neck pain, arm pain, low back pain, or a host of symptoms, any kind of conditions or diseases. When you break down that energy field, it leads to problems. Let me illustrate that with a little chart here that I have. And this would be the energy of the body in total balance. See that? Okay. Total balance when it looks like that. Then when you have one of these other patterns here to this side, that's when the energy gets disrupted, and that's when it leads to problems. Let's take this one for instance. You see the energy is different from the front to the back of the body. Well, that could be where people might have problems or symptoms in the front of the body or the back of the body. This one could be on one side or the other. They could have problems on one side of the body or the other. They could have left leg pain, left shoulder pain, headaches on the left side of their head, or you can reverse that, vice versa. Here's another situation where you can have problems above or below the diaphragm, because the diaphragm is kind of like the division between the top part and the bottom part of the body's energy. So somebody may have a problem or a blockage, an energy blockage below the diaphragm, and that could lead to lower extremity problems, problems with the knees, problems with the feet, poor circulation in the legs. Or it could be where the energy is blocked above the diaphragm, so they could have arm pain, headaches, eye problems, anything that could be affected above the diaphragm. And then there's other scenarios here, different combination patterns that could cause just about anything. So that's what you don't want. You don't want any of these patterns. You want this right here. That's perfect energy balance. So what do we do about that? How do we fix that? Well, through this technique that was developed by Dr. Morter, what we do is we balance the energy with different reflex points. So I don't have a patient to show you here on the table, but basically I'll try to describe this. The patient's flat on the table. We check their legs. If they're out of balance, one leg is short. And then we check the legs down, and then we pick them up to 90 degrees, and we check them in that position. So there's the little details, little things that we look for up and down to tell us what we have to do, how do we have to work on the patient. Okay, then when we find the imbalance in the autonomic nervous system, which is part of the energy field, and it's either sympathetic or parasympathetic, we fix that by various reflexes. It's not acupressure. We hold contact points. They're not painful. It's the same amount of pressure that you would put on your eyeball with your eyelid closed. So it's very, very slight. And then what we do is we wait for balancing of the pulses. And then we check. We go back down to the legs. We check in the down position, even legs, up position, even legs, and we know the patient's balanced. And a lot of times we'll have to do that in addition to the adjustments, because the nervous system and the muscles are involved in being able to hold the adjustment. So the advantage of this is that the patient will get better much quicker, much more rapidly than just giving regular chiropractic adjustments. So that's another technique that we use to help patients get better faster. So if you want to find out more about this, our information is at the bottom here, our webpage, contact information. You can find out more about it. If you have a question, maybe something I haven't covered, feel free to go to that website. There's an email link there. You can email me, and I'll be glad to answer your question. Okay, very good. So I just want to say thank you for your attention, and I'll say bye for now.